more choices are always good. Having more options is good. Patch users represent a small proportion of overall users of combined hormonal methods, for a variety of reasons. I think that, the initial introduction of Ortho-Evra, decades ago, had a lot of excitement around it. And then, with the subsequent, safety concerns that were raised, that sort of dampened the enthusiasm a bit. I believe that most consumers really didn't ever understand the safety concerns. So the patch use, has its own inherent, sort of limitations. A lot of, it's one thing if you're 60 and wearing a patch for heart chest pain, but harder when you're 17 and wearing a bikini. So I think that those are limitations for patches all around. That said, it provides something. It's a weekly option, that has advantages for many users who want a non-daily routine. And there's been a lot of innovation over the years, trying to produce, patches, to meet need. And there are several on the market. Ever never went away. It just went away from Ortho. There's been, other work that's been done. There's been the approval of Xulane, which is a levonorgestrel patch. There have been levonorgestrel only patches that have also been in development. But the Xulane patch is been on the market, and it has some penetration. So this patch, is another flavor. I think it's in the right direction. Reducing synthetic estrogens, is a direction in the right way. It's the same basic EE concentrations that you'd expect to see with the levonorgestrel patch. So nothing is really particularly innovative or different there. So we're going to probably suspect, the similar, safety signals. It's going to have similar contraindications, the same labeling for BMI. The Pearl Index they came up with is in line with the way methods are evaluated now in the U.S. And there's been lots written about that over the years about why Pearl indices are higher in the U.S. than Europe, and why they are different than they were 30 years ago. So none of that is surprising.